Hello everyone, today we'll be studying about the oral antral communication and the oral antral fistula. So let's talk about the definition. The oral antral communication are probable surgical complication of the dentoalveolar procedures. What is oral antral communication or perforation? It is the unnatural communication between the oral cavity and maxillary sinus, whereas oral antral fistula is the epithelialized. This is epithelialized, pathological, unnatural, abnormal communication between the oral and the antral cavities. The difference is that it is epithelialized communication, okay, but this is not. It develops when the oral antral communication fails to heal spontaneously and remains patent and gets epithelialized. This process of epithelialization begins after 48 to 72 hours of the oral antral communication. There is a migration of the oral stratified squamous epithelium into the defect. It takes at least of 7 to 8 days for the oral antral communication to epithelize, and then it forms a canal or tract lined by epithelium that may be filled by the granulation tissue or by the polyposis of the sinus membrane. The fistula gets established within few days, and due to the presence of the foreign bodies or development of the maxillary sinusitis, the spontaneous healing process is disturbed and may result in the chronic fistula formation. The patency of the tract is preserved until the epithelial cells are scraped. The etiology. The oral antral fistula can result from the several causes. There may be the extraction of the upper molars and the premolar teeth in 48% case, tuberosity fracture, disruption of the portion of the floor of the sinus by periapical lesions of the maxillary posterior teeth, implant dislodgement into the maxillary sinus in 4.5% case, perforation of the floor of the sinus and sinus membrane with the injudicious use of the instruments, forcing of a teeth or a root into the sinus during its attempt of removal. Similarly, extensive trauma to the face, surgery of the maxillary sinus, while removal of the large cyst lesions encroaching on the sinus cavity. The chronic infection of the maxillary sinus such as the osteomyelitis, osteoradionecrosis. Now, teratomatous destruction of the maxilla such as the gamma involving the palate. Similarly, the infected maxillary implant dentures. As a complication of the Cordwell-Luck surgery or the malignant diseases such as the malignant gland. The symptoms of the fresh oral antral communication is 5 E's, that is the escape of the fluid, epistaxis, the escape of the air, enhanced column of the air, excruciating pain. The escape of the fluid. The regurgitation of the fluid taken from the mouth into the nose on the side of the extraction. This happens when the patient rinses or gargles the mouth following the extraction of the tooth. Epistaxis, that is unilateral. It is due to the blood in the sinus escaping through the ostium into the nostril. It may or may not be associated with the frothing at the nostrils on the affected side. Escape of the air from the mouth into the nose on sucking, inhaling, or drawing on a cigarette or puffing the cheeks, inability to blow the cheeks, passage of the air into the mouth on sucking. Similarly, enhanced column of the air causes the alteration in the vocal resonance and subsequently change in the voice. Similarly, excruciating pain in and around the region of the affected sinus as the LA begins to wear off. Now, similarly, in the late stage, that is the symptom of the established oral antral fistula, we should remember 5 P's, that is pain, persistent purulent and the mucopurulent, foul unilateral nasal discharge. Similarly, post-nasal drip, possible sequelae of the general systemic toxemic condition, popping out of an antral polyp. So the pain, previously a dominant feature, is now negligible. As the fistula is established by epithelialization, it allows the free escape of the fluids. The persistent purulent or the mucopurulent foul unilateral nasal discharge from the affected nostril, especially when the head is lower down. Unilateral foul or the fetid taste and smell. Postnasal drip, the trickling of the nasal discharge from the posterior nares down the pharynx. The continuous swallowing of the foul mucopurulent discharge may lead to unpleasant taste. This is accompanied by nocturnal cough, hoarseness, earache, or the catarrhal deafness. Possible sequelae of the general systemic toxemic condition like the fever, malaise, morning anorexia, frontal and the parietal headaches, and in extreme cases anosmia and cacosmia. Popping out of an antral polyp. The persistent infection in the antrum may lead to establishment of the chronic long-standing OFA, which may be occluded by an antral polyp. This can be seen in the bluish red lump extruding through the fistula. Here we can see the popping of an antral polyp through the long-standing oral antral fistula.